Hello everyone and welcome back to my channel where I unravel the complex web of mental health. In today's video, I will delve into an intriguing intersection that is often overlooked, the confluence of nutrition and mental health, specifically focusing on anxiety. Before I go any further, I would like to say this information is intended for educational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider before making any medication or lifestyle changes. Numerous peer-reviewed studies, including comprehensive meta-studies published in renowned journals like Psychiatry Research, have started to highlight the undeniable correlation between dietary habits and mental well-being, particularly in the realm of anxiety disorders. We have all heard the phrase, "you are what you eat," but have you ever considered what this really means in terms of mental health? Nutritional psychiatry is an emerging field that examines how food and nutrients can affect our mood and mental state. The Journal of Clinical Psychology has stressed the pivotal role nutrition plays in emotional regulation, influencing neurotransmitters that govern not only our mood but also our response to stress. To understand the role of nutrition in managing anxiety, we need to delve into specific diets that have been shown through rigorous clinical trials to have a positive impact. Let's begin with the Mediterranean diet, which is heavily supported by scientific research. A study published in Nutritional Neuroscience indicates that individuals following this diet, rich in fruits, vegetables, lean protein like fish and poultry, and a healthy ratio of omega-3 to omega-6 fatty acids, experience lower levels of anxiety compared to those on a typical Western diet high in processed foods and sugar. Let's now explore the low glycemic index diet. Unlike diets that focus on macronutrients like carbohydrates, protein, and fats, this one aims to control the rate at which sugar is released into the bloodstream. Foods with a low GI, such as whole grains, nuts, and legumes, allow for a gradual rise in blood sugar, mitigating the sugar crash that is often implicated in anxiety symptoms. Research published in the American Journal of Clinical Nutrition indicates a substantial improvement in emotional well-being for individuals adhering to a low GI diet. Now, have you ever heard of gut health being related to your mental well-being? Probiotics, or the good bacteria found in fermented foods like yogurt, kefir, and sauerkraut, have been linked with reduced symptoms of anxiety. A study focused on the gut-brain axis emphasizes how probiotic supplementation can alter the biochemical signaling between the gastrointestinal tract and the nervous system, effectively reducing anxiety. Lastly, we can't overlook the role of micronutrients, vitamins, and minerals critical for various biochemical processes. For instance, B vitamins play an essential role in neurotransmitter synthesis, while minerals like magnesium act as natural muscle relaxants. Foods rich in these micronutrients include whole grains, legumes, nuts, and leafy greens, and there's mounting evidence in journals like Nutrients to show that a deficiency in these micronutrients can exacerbate anxiety symptoms. While our primary focus has been dietary approaches, it would be remiss not to mention other holistic strategies that can work in tandem with nutritional plans for an integrated approach to managing anxiety. Activities like mindfulness-based stress reduction, yoga, and even conventional aerobic exercises like running have shown significant benefits in randomized controlled trials, as cited in the Journal of Mindfulness and Stress Management. As I conclude this evidence-based video, I hope you leave with an understanding of how adopting specific dietary practices can be a critical cornerstone in the holistic management of anxiety. Alongside conventional treatments, these dietary changes offer a multidimensional approach to care. I appreciate your engagement with this enlightening topic, and as always, I invite your questions and thoughtful discussion as we work collectively to advance the mental health dialogue. Before I bid farewell, let me take a moment to mention our sponsor for today's episode. This in-depth presentation is brought to you by Embracing Euthymia, a guide to cultivating mind wellness for patients, caregivers, and providers. If you want to explore this rich field further, the guide is now available at Amazon bookstores. To get your copy, click the link in the description below. If you like this video, subscribe to my channel for more evidence-based content. Until next time, this is Dr. Nkendong, psychiatric mental health nurse practitioner.